Thanks, Sally, and as Sally mentions, a warm welcome to you all. This really exciting happy hour this afternoon. It's actually made possible both by our partnership here with the Dementia and Housing Working Group, but also the UKRI and the Healthy Ageing Challenge, who are very much sort of supporting the LIN and the role that we have in terms of sharing and cascading information and knowledge. And disseminating good practice. As Sally says, we have a really exciting program for you, and we're going to be looking both at the launch of the Padlet, or the Dementia Information Hub, but also sort of highlight some of the still key findings that came out of an influential report, and it looks a bit blurred probably, from Lord Beth's APPG, housing for people living with dementia. Are we ready? And that sort of "Are we ready" theme, something that we will sort of look at during the course of this afternoon. We also very much hope that by today, a few weeks after a couple of weeks after the Dementia Awareness Action Week, that we would also have a national strategy. That isn't here yet, but all of us on this call are really keen to inform and influence that, to ensure that housing with care has a voice, a role to play in that national forthcoming strategy. And that APPG report, if you haven't already seen it, is on the HousingLIN website, on the Housing 21 website, and sets out a number of recommendations, over 40. And we're going to touch on, as I said, a number of those today. I'm delighted it was co-written with Katie Twyford, our former dementia champion at the HousingLIN. And I know Wendy Wells and Candy Wolf are currently working with us, and also members of the Dementia and Housing Working Group as well. So I'm going to pass over to Vanessa Pritchard-Wills, chair of the DHWG. She's done a great job of pulling and corralling us all together, and we've got some great announcements for you all this afternoon. And Vanessa, you're going to talk a little bit about the background of the DHWG and about the recommendation 34. So over to you.
Thank you, Jeremy. So good afternoon, everyone. Thank you for joining us this afternoon. And I hope it's as exciting as it's built up to be. So as Jeremy said, I'm Vanessa. I chair the Housing and Dementia Working Group, and on behalf of Housing 21, and I have done for 3 or 4 years now. So a bit of history about the group. It was actually developed by the National Housing Federation over 10 years ago. And the group is now made up of a number of housing associations, groups and networks, and organisations with an interest in housing and dementia, including the National Residential Landlords Association, which represents the private renters sector, tied together in Dementia Every Day for carers, and also some government departments, amongst others. So the overall aim of the group is to promote the positive impact of appropriate housing to enable people living with dementia to live as well as they can do. As Jeremy's mentioned, the group inputted into the development of the dementia-friendly housing guide, and we have spoken at Dementia Congress on a number of occasions and other events to try and get our message across. We think it's really important to keep the conversation around housing and dementia right at the forefront of people's minds, and we're really striving to do that. So we meet quarterly online, as we all do nowadays. Pre-COVID, we hosted a couple of events which we named Housing, Rising to the Dementia Challenge. We started to do this because we were getting a feeling that dementia was seen as really an older person's housing provider issue. So we really wanted to get the message across that working towards becoming dementia friendly doesn't have to be costly or involve a huge project, but actually small changes to a service can actually result in really positive changes for people affected by dementia. So we're holding another one of these events on the 23rd of June in London, and we'd love to see you there. It's in person at Trowers. Tickets are on Eventbrite, they're free, and I'll put a link in the chat box. We've got a range of different speakers covering, first of all, most importantly, the voice of the person living with dementia, design, technology, and the conductor of a dementia choir. We actually have short presentations at those events, so speakers are given 10 minutes to really sort of focus the mind, and the idea is that people can go away with several takeaways on how they can change their service offer and really become more dementia friendly. So we were delighted to see the inquiry on housing and dementia by the APPG for housing and care for older people. And as a group, we were really keen to take forward some of the recommendations. So the two that we chose to focus on initially are the subject of today's webinar. So recommendation 34 was to consider the design and adaptability of people's homes in meeting the needs of those living with dementia. So we started with this brief. The scope did grow a little bit in terms of this, and we created the Padlet that Yasmin will be speaking to you about. And this is what we really want to be a go-to resource for professionals, but also for people living with dementia, their carers, families, etc. And then recommendation 35 was around appointing dementia champions at an executive, senior management or board level to demonstrate organisational commitments at the highest level. And again, you'll hear about this later by Ruth. We'll also constantly address recommendation 36, which talks about utilising the Alzheimer's Society Dementia Friendly Housing Guide and actively promote this. If you haven't seen the guide, it can be downloaded either from the Alzheimer's Society website or the HousingLIN website. We're also planning to look at other recommendations around housing options and choice to help signpost people to appropriate housing as soon as possible and see how we can contribute to making housing and society more dementia friendly. The APPG report also asks, if dementia comes our way, are we ready? Will our home serve as well? Will it be somewhere we can continue our lives together or alone? And one way of achieving this is through the use of technology. In some ways, it's taken a pandemic to highlight the importance of this digital technology and connectivity. And according to Ofcom, the digital divide has reduced from 11% to 6% of homes. So that's 1.5 million more people who have started using the internet. People with previously limited digital skills have embraced online shopping, digital banking and video calling. However, we also know there are 1.5 million homes remaining offline. So we know there are many barriers in embracing technology, particularly for those living with dementia. But at the end of the day, it's got to be right for the individual, personalised and to their changing needs and support. So in all of the recommendations that we work with and the other work we do, we'll be seeking to introduce technology in everything we do to make life as accessible as possible. So that's just a really brief introduction to the group and to the recommendations. If you would like to know more about the Housing and Dementia Working Group, please do feel free to contact me. We're always looking for members who will be active in helping us fulfil our work and keep that conversation around dementia and housing alive. So I will now hand over to Yasmin, who will talk about the Padlet as our go-to resource. Thank you, Yasmin.
I will just share my screen. Okay, can you see that presentation? Okay, hi everybody, my name is Yasmin Hussain. I'm a policy executive at Foundations, the national body for home improvement agencies, and also a proud member of the Dementia and Housing Working Group. And today I'm going to be talking about a new and exciting resource that we have been developing over the past few months to respond to dementia readiness. And I'm sure you will have guessed, that is our Padlets. In this presentation, I will be explaining what the Padlet is, how we developed the Padlet, and then finally, why we're actually doing this work. In short, the Padlet is a really exciting tool that can be used to inform people about all things dementia related, so we hope that it will be helpful for you. Before I start, I'd just like to say that there's a link to the Padlet in the chat if you'd like to see it for yourself. So, what is a Padlet? Padlet is essentially a tool that helps people make and share content with each other. Somewhere between a document and a full-blown website, we thought that this notice board style page would be more user-friendly and less overwhelming when searching for information. This specific Padlet is a Dementia and Housing Working Group's response to taking forward the key recommendation of the all-party parliamentary group's report about housing for people with dementia. This recommendation is that ideas and information are there to be shared and reflects the main theme of this report, which is being dementia ready. So then, this Padlet is a go-to resource for those living with dementia and their carers, as well as policymakers, housing developers, health and care professionals, building environment, supply chains, and everything in between. It aims to signpost any dementia-related resources out there and create a place to pool information. So here is a quick rundown on how we made the Padlet and what we did to make the Padlet page, which I will go into in a bit more detail in a minute. I just wanted to add that since the last time we spoke about the Padlet, it has been piloted and tested with people with dementia, which you will hear more about later. But I thought that this was an important thing to point out, as we've been developing this page since Christmas with a pilot with Livewire, who are social prescribers in the Warrington area, who I'm sure you'll hear more from later on. So I'm now going to share my screen so that you can see the Padlet. So as you can see here, this is the title of the page, the Dementia Information Hub, and a short description about what the page aims to do. To create the Padlet, the Dementia and Housing Working Group came up with some key columns to structure the page, as you can see by scrolling here. All you have to do to access the content is click on the link, and it will take you to the relevant page, and it will take you to the content so you can access the information. If you are trying, the content on this page has been approved by the Dementia and Housing Working Group. So they're relevant to these columns. So all the information on this page is relevant to the specific columns that they fall under. We wanted this page to be a growing national resource, so that we want there to be loads of content on this Padlet to help inform and guide people. If you are trying to navigate specific content on the page, you can do this by using your browser's native find function. So this will probably be pressing the Control and F button or the Command and F button like this, and then typing in the relevant word, so say foundations, and then it will take you to all the information that comes up under this search key like this. Since the initial creation of the Padlet, we have listened to your feedback and developed a new column for local financial help, which I would like to demonstrate now. So to access local financial support, you click on this page here, and surprise, surprise, it should take you to another Padlet. So essentially, if it wants to load, this Padlet is a map with local financial assistance available. So you navigate the map to find your area, and then hovering over, it will tell you how much financial available or how much financial assistance is available, or if it's a housing assistance policy. So for example, in Havering, it will tell you the page number. You can click on the policy. So for this example, it's page 28, either scroll or type in the page number, and it will take you to the information and the available local financial assistance in your area. So going back to the page then, as I said, this map is a work in progress, so it's developing, but we'd really like to hear your thoughts on this recent update. For adding content, so as you will probably notice, under each column there is a plus sign. So to add content, you will click on the plus sign like this, and then type in a subject or a heading for your content. So for example, like this, obviously with the right grammar, and then you will take the link. If you're wanting to add a website, you'll take the link from the website that you want to share it to and paste it in here like this. The good thing about Padlet is that it lets you use different forms of resources and upload these onto the page. So say if you want to upload a YouTube video, you can click here and search the YouTube video in. But if we're looking to upload a website, we just paste the link here, press the arrow, and then click publish. As I mentioned, the content has been moderated on this page, so your page will look a little different if you're adding in content, and the post will have to be approved by us before it goes live on the site. So don't worry about posting anything accidentally, because it will have to be approved by us before it goes live on the site. Another nice feature of the Padlet page is that it lets you communicate and interact with the Padlet itself. So you can add a comment here by commenting on the little speech bubble and typing in a comment like this, or you can rate the page out of 5 by clicking on the stars and rating the page out of 5. As feedback is very important to us, we have actually developed a column specifically for feedback with a really short survey, and we'd love to hear your thoughts on this. So to access this survey, you just click here and it will take you to a short, only 3-question survey. Finally, if you have any questions about this or you want some instructions, the first column is a how-to guide, which you can again just click here. and it will take you to some instructions on how to navigate the Padlet, how to use the Padlet, how to add content to the Padlet, and interacting with the Padlet. Okay, so moving on. I will just go back to my presentation. Okay, so I briefly mentioned how this page is a response to the APPG report.
Sorry, Yasmin.
Yeah.
I can still see the Padlet. I don't know if that's the same for everybody else.
Sharing and reshare my screen.
Thank you.
That's fine. Thanks for letting me know. Is that better?
Yeah, perfect. Thank you.
Thank you so much. So I've just mentioned about how this page is a response to the APPG report, but now I want to outline more specifically where this page fits in with the broader dementia agenda and how you can get involved. The Dementia and Housing Working Group have developed this Padlet in response to moving towards being more dementia ready. And this is because there's lots of information out there about dementia and for people with dementia, but this can be tricky to find. We're hoping that this resource can help to improve collaboration and help to inform people. The Padlet is specifically linked to recommendation 34 of the APPG report, which you can see the nice little 2-pager for on this slide. And this says that providers of housing should consider the design and adaptability of their homes to meet the needs of those living with dementia. This Padlet page is therefore a go-to resource to assist the implementation of dementia-friendly housing, improve collaboration and share information in this area. You can read more about this on the 2-pager, which has been made and I can email out, and looking into how the Dementia and Housing Working Group has responded to this. So how you can get involved. You can get involved in the Padlet in 3 ways. Firstly, you can benefit from having your organisation's work showcased on this resource by posting your services or guidance onto the Padlet, as I previously demonstrated. We'll then approve this before it goes live. Number 2, you can share the Padlet with your colleagues, residents and service users as a web link or as a QR code, which you can actually access on this slide by turning on your phone camera and accessing it through your camera. If you just hover over the QR code on this screen, it will take you to the Padlet. And finally, you can embed this resource onto your own website, as we can share the HTML code with you to do this. As an important part of being dementia ready, it shows that you are able to guide users to best practice resources. We'd really appreciate any thoughts, comments or feedback that you may have on this page, and we're hoping that we can continue to develop this as a resource. So we'd be really keen to hear your thoughts. You can either email me or fill in the feedback form on the Padlet, which I can provide a link to in this chat. To sum up, Padlet is a continuously developing resource, and we'd love for you to get involved in helping us make this tool as useful as possible. Thanks for listening, and please feel free to email me if you would like any further information. Thank you.
Yasmin, thank you very much, and that was really great. And Vanessa, thanks for also for sharing background information. And I think, as both of you say, the involvement of carers and support is really important. And I'm delighted that Susan can join us as well. So, Susan, over to you from Livewire.
Well, hello and good afternoon, everybody, and thank you for joining us. Can we just, okay. Well, my name is Susan. I'm the social prescribing link worker for South Warrington PCM. We are part of a team of 5 and we have our own geographical area. So mine is actually in the south. Can I have the next slide, please? Okay, my role as a social prescribing link worker. Well, as I said previously, there is 5 of us that we work in the whole of Warrington. The appointments are made to see us through GP practices or healthcare assistants, and the appointments that when we see patients can either be on the telephone or face to face. The type of patients that are referred to us are patients that the GPs think that their health and well-being are being affected by things that are outside of their kind of clinical area. So some of the problems that we see patients for are for benefits, housing, social isolation, depression, mental health, and dementia, and support for the carers of dementia sufferers. The process of social prescribing, first of all, is we first have an appointment with the patient, and that is usually for about an hour, because a lot of the time the patient has lots of problems. They don't usually know where to go with it, what the actual problem is. So we usually spend about an hour just listening. After we listen, we then try to come up with a plan forward. This could be 1 or 2 points, but it's an agreed action plan with the patient. Then the social prescriber goes away and finds all the resources that the patient needs. So if it's referrals, if it's appointments, if it's connections with support organisations, it takes away the pressure off the patients having to do this themselves. After that, we then make follow-up appointments with the patients to make sure that they've had contact with the organisations. Which brings me to dementia. Throughout our work in Warrington, all of us have been receiving quite a few referrals for patients suffering from dementia and their carers. So this has led to us having to research the local and national area for what actual resources are out there for the patients. Can I have the next slide, please? This is where we first came across the LiveWire sites. I've got 2 centres, and they've got many neighbourhood centres and hubs, but Bursley and Dalham and Great Sankey are both new sites in Warrington. Now, these were both built, designed and built based upon intelligence done by the local clinical commission group and the local authority. They then discovered that dementia was prevalent in West Warrington, was way above the UK average. So in response to this, they got together to work with the University of Stirling and John Walker to design these buildings, which was to make the residents have a cognitive impairment and also to be dementia friendly. Now, these buildings, some of the considerations and design aspects of these buildings were based upon the flow of the building, the lighting, the signage, the acoustics, and making sure that the services were friendly. They're actually dementia friendly. Now, it was great to say that Great Sankey was awarded the first gold award for the public building that was designed this way. And Great Sankey has also achieved notable interest locally and international. Now that COVID is subsiding and LiveWire and the partners, they're revisiting these programmes and they're looking at developing even more and more for carers of groups suffering with dementia, and they're looking at organising more individual sessions, and these could be anything, you know, one-to-one sessions that are now available in the local area, but they're trying to bring into the building so that these 2 buildings become, if you like, the cornerstone, the key hubs in Warrington for people who are looking for dementia services. Next slide, please. This brings us to the Dementia Padlet. The social prescribers were asked would they pilot the Dementia Padlet as part of the launch. Obviously, because we have so much communication with people suffering with dementia, GPs, etc., and the people who provide the support, it seemed like, you know, a really good point of contact, if you like. We decided as a team that when we were looking at the pilot, what we would do is we'd look at how easy it was to access for both our patients and for other support organisations, how easy it was to navigate, what the quality of the information was and how relevant it was. So, you know, the information that we were looking for our patients, was it there on the Padlet, and how useful it was. So we didn't just look for what was on the Padlet, we actually clicked on the links, we followed them through, we made the calls, and we tried to see how quick or which were the best, if you like, the best sites. When we did this, we put a report together and we fed this back to John, who's in charge of the report. After this report, I continued to work on looking at the Padlet. So every time I received a referral for a patient, my first point of contact was the Padlet. I was seeing what was on there, could I get everything that I needed, and if I didn't, what was actually missing. And one of the things that I discovered was that an awful lot of the patients were asking me about support around their homes. The problem was that they own their own homes and they were concerned that they would need to sell their own homes in order to pay for support for their parents or whoever it was they were caring for. When I fed this information back to John, he was able to add another column, and it's great to see that the Padlet was updated based upon what we fed back and what we felt like the people we were working with actually needed. Going forward, social prescribers have decided that what we were going to do is all referrals that we receive for dementia, we are going to signpost the Padlet as a first point of contact for the carers and people who we are first referred to. We're also then going to use the Padlet ourselves, and again feed back into that as to what we can't find, what we found the most useful, use the grade, the stars, etc., so that everybody can see what we're finding and what comments. Also, what we're aiming to do is, throughout the last few months, we've built quite a large bank of resources for dementia for across the whole of Warrington area. We've been using some national resources, but we've also, as I say, built a really large bank of really useful resources. These are, voluntary organisations, local support groups, people, who work in and around with these people on a daily basis. So what we've now done is we've put together this as a kind of an action. So what we're aiming to do, obviously, is to look at building a regional area on the Padlet for support, so that people who are going to the Padlet, like the map we've seen before, that there could be just a key area for the support for in and around the Warrington area. So I think that's where we currently are today, and hopefully that we're looking to build upon what we've currently found useful in the future. So I think I conclude my presentation. I think we're going to do questions later.
That's right. Well, thank you very much for both sharing the work that you do across Warrington, but also how you personally have taken the Padlet and tested it out and reported through John. And that's a real great example of us sort of co-producing, in a way, this Padlet, and something we'll continue to do following Yasmin's presentation. So thanks ever so much. And our final speaker this afternoon is Ruth Ely. Ruth, welcome aboard. Please do introduce yourself and Tide and the work you've been doing around both the work with carers, but also around recommendation 35. You're muted.
Thanks. I'm the chair of Tide, Together in Dementia Every Day. We're a charity that runs an involvement network for carers and former carers of people with dementia. And we invest in those carers through our development programme. We provide education and training opportunities because we want to enhance the skills and the knowledge and increase the confidence of carers and former carers so that they're able to speak up and influence decisions, policy, practice, research, housing, whatever. So I was asked if I would do a quick feedback exercise with some of our carer members and about the Padlet. So just to supplement what Sarah said already, these were carers who hadn't used Padlet before. It's a new platform to them, but they found it very easy to navigate. It was clear, it's easy on the eye, and they soon got the hang of navigating across as well as up and scrolling up and down. They wondered how it had been put together in terms of the ordering of the categories. And in our discussion at our group meeting this morning, we commented that it does seem a bit random, but then we don't want to direct people too strongly in particular ways. It's about people finding out for themselves. It's not like a traditional website where you click on a link and you go in and then you drill down. It's about taking a walk through the whole thing. So that's an important principle, I think. And it's evolving. You know, you heard Yasmin say that, you can add content. Obviously, we'll moderate it to make sure that there's nothing offensive in there. But, you will add to it and it will grow and we will learn and it will evolve. So this is a very early stage of its development. And I must apologise because I just called Susan Sarah. I'm so sorry. So really good feedback from carers. They like it. One said it would have been really useful when Mike was first diagnosed and onward from there. And people were really keen and enthusiastic about it. So the next bit of what I'm going to talk about, if you could put my presentation up, please. Thank you, Sally. I'm going to say a little bit about recommendation 35 and what we've been doing in the Dementia and Housing Working Group. I'm wearing another hat here as well because I'm a board member for Wales and West Housing Association in Wales. It's one of the biggest associations in Wales. So I find myself on the board taking a lead role in dementia. So I was interested and very keen to be involved in taking forward this particular recommendation. So can we have the next slide, please? So just to remind people what section 35 says, we recommend providers of housing for older people in the private and social sectors appoint dementia champions at executive, senior management or board level in general needs, social and specialist housing bodies to demonstrate organisational commitment and ensure effective leadership at the highest level. So this is across sectors. It's not just about specialist housing. It's about general needs, and it's in the private and the public and the social sectors. Next one, please. So what did we do? Well, we set up a task and finish group and we drafted a spec for champions at board level. And through that process, consulted with some of our members. We didn't do a whole raft of consultation, but we checked out our direction and our content with several members. And our final version was approved this morning. And I think Sally's going to put a link in the chat when I've finished to the PDF that you can access for yourself. So just to elaborate a little bit on the purpose of the spec. Next one, please. We agreed that the primary role of the board champion is to provide leadership, and through that helping their organisation to find ways of improving housing and services to people with dementia and carers. And that's both its current residents but also prospective residents, so that the offer to potential residents will be clear about where the board sits and what it's aiming to do to make life more livable for people with dementia and carers. As I've said, housing refers to mainstream and specialist housing, whether it is operated by social housing providers or the third or private sector. We're clear that we're not looking for people who are dementia experts, but we want them to have a basic understanding about the condition and its impact. And I think if we were in a room and I could see everybody, if I asked people to put their hands up if they know somebody with dementia, not professionally, but in their own life, as a family member, a friend, a neighbour, at least half of you will be putting your hands up. Dementia impacts many lives, and that's why it's important that we all understand its condition and its impact on those lives. And we want the person concerned to be committed to helping the board improve services for current and prospective residents and their families. Next one, please. And we've set out in the spec how we think they can do that. So, first one is to be accountable for the board's dementia strategy or plan. But of course, if your organisation doesn't have one, then we would expect the champion to be promoting the need for that and helping to identify how best to produce that. We want people to keep up to date, and that's up to date about the dementia world, but it's also about organisations and resources that may be able to offer advice on specific developments. For example, if you're being asked to consider a case for capital or revenue funding, or the design of refurbished or new build stock, to ensure that there'll be dementia inclusive. We want people to be familiar with acceptable language and terminology, and act as a role model with other board members, with managers and staff. And for those of you who aren't familiar with it, DEEP, the Dementia Engagement and Empowerment Project, has produced a really good guide on language, acceptable language and terminology for working with people with dementia. It follows from that that we want people to be prepared to challenge and feel confident about that. So if proposals come to the board that don't appear to meet the needs of residents with dementia and carers, we want people to be confident to speak up and question that. We want people to be familiar with a rights-based approach, and by that we mean, for example, understanding that dementia is a long-term condition and a disability rather than purely a medical condition. And if we look at it as a long-term condition and a disability, this places it firmly within the remit of the Equalities Act, which gives you some levers and tools to challenge discrimination and people being excluded from services, rather than as a mental health problem, which is where it often sits. And we want champions to be alert to safeguarding matters and to adopt an approach of what does this mean for our residents with dementia and their carers when items come to the board. So that should be at the forefront of their thinking. And of course, given that they're there to be accountable for the board's strategy or plan, we would suggest that they should provide an annual report to the board summarising their progress and gaps. So what's next? Next slide, please. The champion spec's available. You can download it, and we will be promoting it widely and encouraging all of you and all our stakeholders and colleagues to promote it widely and use it. We want feedback on its usefulness and effectiveness, so please let us have your comments if you think it can be improved, or if you try to use it in your own organisation. Let us know how that worked out and what we could do better. Thank you.
Ruth, thank you very much. And I was reminded as you were presenting about this, the leadership element, but also how it can be helpful to underpin investment and planning decisions and at a local level, at an operational level, but where that strategy and plan is. Often, there isn't that accountability. And I think, what you've demonstrated here is both sort of some of the systems issues, but also the person-centeredness as well, to ensure that the voice of people with dementia and their carers are also thought about in this process in terms of that, in that leadership challenge set out in the APPG. So thanks ever so much for sharing that. And we've got some minutes for questions and answers, and if you haven't already checked it, there's been some really sort of affirmative comments through in the chat box. Thanks everybody who's made comments, and I know also there've been several people who've been tweeting as well. So if you are on social media, do tweet and retweet and read those as well. But I'm going to just sort of start through, and we'll see where we get to. Please do, if you have questions that you haven't posted yet, or something triggers a question in your mind, do put them up in the Q&A box. And I'm going to start off with Paul raised an issue which probably is for Susan. I don't know if you saw this, Susan, but he was very interested in whether there are social prescribing link workers in all regions of the UK, or whether this is something specific to Warrington.
No, what I would say is I think Warrington is quite behind. I can't say that in all regions. I know that in London, it's been quite popular for a number of years. GPs are saying they couldn't live without it because, the amount of workload it takes away from the GPs. Liverpool, it's quite, there's quite a lot of it going on in Liverpool. I know in Yorkshire, the social prescribers. I think if you were in your area, the best thing to do is to ask your GP, is there one in that particular practice, or if they're aware of if there was one. But it's part of the PCN, the Primary Care Network. So it's up to each area as to whether they appoint a social prescriber. But I would say that if there's not one there now, there should be one soon.
Well, thanks very much. And I think, from what I understand, the application of social prescription is more and more going to be part of the co-production and person-centred personalisation approach. And the National Academy for Social Prescribing is really interested in knowing where housing can fit alongside this as well. So Paul and others, please do watch out with some of the work that the LIN is doing in other areas and other organisations who are taking a lead on this. Anybody else want to come in on the social prescribing bit? Well, we've got Lincolnshire and Leicestershire have all said they've got social prescribers, so it clearly, Paul, is something that is not just in Warrington. So please do share information with the LIN. We'll be very happy to put a link into our newsletters on that. Can I just come back to a question that we've had from an anonymous attendee who asks us about what the geography of this app, and I think this is the Padlet. So, Yasmin, I was just wondering, the question is it England only? Can it be applied more broadly?
Oh, sorry. So whilst the Padlet is a national resource at the moment, which does just focus on England, we are looking to expand it. So we could expand it, there is scope for that. And also, you know, as we've seen with the local feedback, we've now made the map for local assistance. It's something that we're trying to develop and grow. So I don't think we can really say no to any of the options at the moment. We're just taking on people's feedback and seeing how we can best develop and expand Padlet as a resource. So give us some feedback and we can work with that.
Brilliant. And Julie, on a supplementary, hi Julie, nice to hear from you. You put something about, could the Padlet be used to recruit research participants? He oversees the I can say that the Dementia and Research Consortia, Housing and Dementia Research Consortia. Is there scope here to perhaps include that in a way to engage effectively with people with dementia and their family and carers?
I'll take that one. Yes, I don't see that being a problem. I think the only issue there is just making sure that it does remain up to date. So actually, once that particular research project is over, then that link is removed. But there are all sorts of ways we could link it to different people's websites, etc., that are looking for research participants. Because I know Julie struggles with getting those responses. So yeah, if it can be helpful, then more than happy to look at that.
That's great. And I know it may be something that at some point we can raise with the research councils, because there may also be some things about how we can demonstrate some of the ethicity of it as well. You know, so I know there's issues around getting ethical approval is always an issue in terms of the ways people engage and consult. Okay, that's great. Ruth, there was a question, I think it's been posted in the response in the chat box, but you just want to give a little overview of what DEEP is?
Yes, it's the Dementia Engagement and Empowerment Project, and it's run by Innovations in Dementia, and it's a sort of sister organisation to TIDE. They fulfil a similar role for people with dementia in terms of empowering them, giving them a voice, enabling them to get involved and running sessions for them to do that. They have a group, Dementia Enquirers, that's particularly people with dementia who want to get involved in research, for example. It's not quite the same, it's not the exact equivalent of TIDE, but it's very similar in that we work to give carers and former carers a voice, they work to give people with dementia a voice. So we do work closely together, and they've done some really interesting work, and the guide on language and terminology is really useful. I'd recommend it to everybody, and I see that Yasmin's put it on the Padlet, so thank you for that.
That's great. So that, yeah, there was a question about where is that? So that's great. And in fact, can I also thank everybody who sent information in on the chat box? I think Yasmin is busy uploading information as we go. So this is lovely, you know, that the Padlet is live and interactive through this happy hour session. There are a couple of questions which are more about sort of facts and figures, and I don't know whether anybody's sort of in a place to respond to this. One of them is about how many people with dementia live on their own. Does anybody know the details on that?
So I've just tried to do the maths, and if I remember rightly, 850,000 people are currently living with dementia, 3/4 of which live outside of specialist accommodation and 3/4 of which live on their own, which according to my trusty calculator comes to 478,125. So as long as I've got those initial figures correctly, we're talking near to 500,000 people. And we also know that, you know, a lot of those people are living in in housing that's inappropriate, that can't be adapted to their needs, etc. And although, you know, within the group we are mainly social housing providers, we really do take notice of all tenures and aim for our work to cover all tenures, because we know that actually the ones that, you know, the people that live in social housing probably have the best accessibility and the best access to care. So it's really important that we include all of the remaining tenures as well, including the growing emphasis of the private rented sector. We're seeing more and more older people. I think 12% of older people reside in the private rented sector now, and that comes with its own challenges. So we're really mindful of that fact. And I hope I've got the figures right.
Just to be clear, sorry, Jeremy, just to be clear, that figure is the UK-wide figure for people with dementia, not England.
And the APPG report has a useful infographic on page 14 and 15. I think we've actually got it as a separate PDF as well. But if you haven't come across it, do have a look at page 14, 15. There's some really interesting statistics and facts and figures around the prevalence rates, but also issues around ethnicity. People, you know, 1.8 million carers for people with dementia, etc. And so the other question was how many people are caring for family members. I don't know, Ruth or Susan, whether you have any precise details on that, but I know that the APPG report talked about 1.8 million or thereabouts.
Yes, and it's a difficult one because not everybody identifies themselves as a carer. So it's trying to extrapolate from the number of people who we'd expect to have a diagnosis. And again, that's an expectation because not everybody has a diagnosis, to extrapolate from that how many people you might think would be in a caring role. So it's a bit of a guesstimate.
Mm.
Yeah, I think I would agree with Ruth. Even if you did have an actual figure there, I think, again, you'd have to take that into consideration, because one of the key questions that we ask as soon as we actually speak to the carer of a dementia is, are you the carer? More often than not, the answer is they are an informal carer. So them statistics aren't even registered out there.
An informal carer, interestingly, is a term that many carers don't like because it sort of degrades them. You know, that we tend to talk about unpaid carers because that's what they are. They're doing a caring role. They're the largest dementia care workforce, but they're unpaid.
And Andrew, you raised a really interesting question. I think you're looking at more globally, and in terms of well-organised and curated information, is there a country that's really leading the way in this coordinated approach? And you give, you know, for example, Japan. Any comments from anybody around that?
I don't know is the answer. I think it's a really interesting question. I know we've been involved in some research with Altair recently, and Japan has really come out as the forerunner in terms of, you know, having all the structures in place for that they have a very aged population, don't they? So actually the government has responded to that, and it is far more structured in its sort of caring and housing approach than we are. But in terms of answering Andrew's question, not something I'm aware of, sorry.
Sorry, go on, Ruth.
Sorry, Jeremy. Japan started the idea of dementia-friendly communities and dementia friends. That's where that concept came from originally. So yeah, they've done a lot, but I don't know specifically about the housing field.
Yeah, no, in terms of housing, I'm not aware. The country, I would say, or the countries that have done, that I believe have done quite a lot around dementia, probably the Scandinavian countries and Holland as well, both in terms of not just specifically around dementia housing. And thanks, Bev, for you think Denmark and the Netherlands. I was just going to say, yeah, Holland. So some of the things they've done around inclusivity and inclusive design to incorporate features that are dementia friendly as well. And it's things that we pulled together. And John Walker, that was referenced by Susan earlier, he was also part of a small group of architects, including Damien and colleagues, Damien, who's with us in the participants group, who was on the panel for the APPG, who sort of advised on the design aspects. Damien, if you've got any further insights, do put them in the chat box or in the Q&A box, so we can pick that up shortly. Well, I'm just going to see. I'm not sure whether we've rattled through all the questions already. Have I missed anything? Can anybody pick them up?
I think you've covered them all, Jeremy.
So, well, you've covered them as well, but I think, you know, can I just sort of say that thanks ever so to all of you for wonderful presentations. And I think unless there aren't any more questions or chat comments, I'm very happy to draw this happy hour to an end slightly earlier and give people 8 or 9 minutes back of their time, so before 5 o'clock. But it's been really illuminating. Please do go and look at various websites. I know that Sally's already posted the news items now on the HousingLIN website, and we'll be featuring this through our various communication channels, as will the DHWG, the Dementia and Housing Working Group. I hope everybody's found that a really informative session. Vanessa's put her contact details up. Please do get in touch with us. We really want to see the work of the working group and our other partners, the Housing and Dementia Research Consortia, grow. It's a really important area. I've got a few thank yous. Can I just thank all the speakers for giving up their time? Can I thank everybody who's contributed both behind the scenes, Ali and Wendy and colleagues on the John and others on the working group for giving up their time to help craft and curate and review a lot of the content. If this is the first time you've attended one of our happy hour sessions, we run these weekly or bi-weekly. In fact, our next session will be on the 21st of June, when we're looking at issues around right placing and downsizing, more specifically in a session called Last Homes, Not First Homes, in partnership with Winkworth Sherwood. And we hope we'll have the Homes England as well as Leicester City Council to look at some of the issues they're raising, not just around housing for older people, but also more multi-generational communities as well. As Sally said in her outset, in the introduction to today's session, when we close this happy hour, you'll be asked to complete a short survey. Please do respond. We really look forward to hearing from you. And can I also thank the HousingLIN team behind the scenes for putting on and running this event so smoothly. So if there aren't any further questions, I'm just going to have one final look. I think we're there. Oh, so we've got two little ones. If I can just see if they read them. One's about carbon monoxide has been linked to dementia. I'm not sure we have anybody here who can respond to that specifically. But Laura, if we do get any comments back about the carbon monoxide regulations and how they're due to commence in October, we will certainly feed that back. If you'd like to get in touch with the LIN through the info box, please do let us know, and we can ask people through our regular communiques about that. Okay, well, look, thanks everybody, and really look forward to meeting you all again, and hopefully one day in person too. But for now, wishing you a happy Tuesday evening. Bye.
Thanks, everyone.
Bye.
Bye.